Joining us to talk about your health tonight is Dr. Shannon Winakur of the University of Maryland St. Joseph Medical Center. Doctor, thank you for joining us.
Thank you for having me.
What is it that women need to know about heart health?
That it's important to them as well as, to men. I think there's a very traditional thinking that heart disease is a man's disease and more men are affected by heart disease, and that's just not true.
Is it a media thing? I wonder why we believe that.
I'm not sure. I think that, I think the breast cancer awareness community has been very vocal in terms of women getting their, their breast health checked and mammograms, and it's been very emphasized to women to do that part of their own health care. And I think that, the same has not been the case for heart health for women. And so we're constantly trying to make sure that women know that.
Do women have heart attacks or heart problems at a later age?
They do in general, yes, they do. Women's heart risk tends to go up with menopause, and so it tends to be at a later age than men.
So
young women, go ahead.
Well, I was just thinking people might think about younger men who they know to have had heart issues, and they don't really have that equivalent in the same age range. Maybe it is skewed towards men.
I think that's certainly true. And then along what I was saying earlier, a lot of women know of young women who've had breast cancer, diagnosed at a young age. So I think that tends to stick in their mind a little bit more.
So among women, what are the most common types of heart disease?
So when somebody talks about heart disease, we're generally talking about coronary artery disease. So that's blockages in the heart arteries, and that's what usually leads to a heart attack. Other types of heart disease that the CDC uses and the American Heart Association uses in their statistics every year about the numbers of women that have heart disease includes coronary artery disease, like I mentioned, but also arrhythmias, which are abnormal heartbeats or abnormal heart rhythms, and also congestive heart failure.
How often with any of these conditions are things going on and the patient doesn't know about it?
So, symptoms can be subtle. It's hard for me to give you a general number for asymptomatic, heart disease, but there definitely can be quite a bit of blockage of heart arteries before people have symptoms. I think we all know of stories of people that went in for a stress test and thought it was going to be normal and ended up having bypass surgery, so that's sort of the extreme version. Sometimes people can have arrhythmias and be asymptomatic, so I've had patients come into my office for a routine visit and they're in, say, atrial fibrillation, which is a very common arrhythmia. Heart failure is not asymptomatic, so when you're in heart failure, you know it.
And the symptoms of a heart attack can differ, but don't always differ between men and women?
That's exactly right. So I think there's been a lot of emphasis for women knowing that they can have different symptoms than men, but it should be emphasized that chest discomfort, generally chest discomfort in the center of the chest, under the sternum, that's a classic symptom of heart disease, of angina, or heart disease from a blocked heart artery. And then also other symptoms that can be a little more common in women can be shortness of breath, general fatigue, flu-like symptoms even at times, that sort of thing.
How similar is that chest symptom, the pressure, to somebody having reflux, somebody going to a Super Bowl party, having too many beers, too many chips, or whatever?
It can be similar. It can be very similar. We all have stories about patients that we've seen in the hospital after their heart attack, and they thought they were having indigestion and they were eating a lot of Tums, and it really was that they were having angina or chest pain from a blocked artery. So it can be very, very difficult to differentiate, and I would just suggest to people, if you have those symptoms, go get checked out.
And why don't people do it? I mean, people are reluctant to embarrass themselves, maybe incur unnecessary expense. I mean, how do you make the argument that we actually want you to overreact to these symptoms a little bit?
Well, because they could be lethal. I mean, you can die suddenly. And so that's what we're worried about. So I tell patients, don't ever apologize for, get worried about bothering somebody about your heart health, getting your heart checked out. You're never wrong to go seek medical treatment, to go to the ER, to call your doctor if you're having symptoms that you think might be from a heart attack.
Let me remind our viewers, if you have a question about heart health, cardiology in general, give us a call. We'll have the number up on the screen, or send an email to livequestions@mpt.org. Let's talk about risk factors a little bit. Is it different among women, and what should people be thinking about?
So the common risk factors, the major risk factors, are similar for men and women. So that would be high blood pressure, cholesterol abnormalities, so a high LDL, that's the bad cholesterol, or a low HDL, that's the good cholesterol, smoking, sedentary lifestyle, family history in male relatives under the age of 55 and female relatives under the age of 65. So those are the major risk factors. But there are some that are more prevalent or more particular to women. Obviously, one would be your reproductive history. So if you have early menses, early menopause, if you had high blood pressure during your pregnancy, if you had diabetes during your pregnancy. I've heard of cardiac specialists in women's heart health talking about these issues during pregnancy as being a failed stress test. And so women need to know that if they had high blood pressure or high blood sugar during their pregnancy, they need to be on the lookout for coronary artery disease down the road.
Interesting. So the pregnancy is the stress test.
Correct.
Not to mention what comes after the pregnancy.
Exactly.
There's a little stress involved there as well.
Exactly.
How much of your practice is spent helping people manage their cholesterol? And what's the state of the art for that?
So a large part of my practice is helping people manage their cholesterol. So, we tend to, we'll check a fasting lipid profile. Anybody over 20 should have a fasting lipid profile, I'd say at least once a year. And that's something that can be asymptomatic. So you can have very high cholesterol and have no idea. So I think that's an important thing, and one thing to know is just to know your numbers, know your blood pressure, know your cholesterol. So, but along those lines, I get a general fasting lipid profile that has the total cholesterol, the triglycerides, the HDL, and the LDL. And those different components, you can use different ways to affect those different lipid, factors.
Let's take a phone call from Allegheny County. This is Lisa. Lisa, thank you for calling. Go ahead.
Thank you for taking my call. Senior citizens now at 60 to 65, how often should their heart be monitored on a yearly basis, or, just to give a general guidance? Thank you.
Thank you.
That's a great question. Thank you for calling in. So certainly speak with your primary care doctor at least once a year about your cardiac risk factors. And like I said, it would be high blood pressure, high cholesterol, smoking, family history, and also your reproductive history. So you should know those things going in. But then usually your primary care doctor will refer you to a cardiologist. So I'll see patients once a year if we're managing risk factors. I'll see them more often if we're managing actual cardiac diagnoses like coronary artery disease, arrhythmias, history of heart failure, those kind of things.
You mentioned checking cholesterol at a young age. Is that a new idea?
Not that I'm aware of. I think since I've been in practice,
I think of it as like you start that in middle age, but
no. The recommendations, I believe, is you should start, with a fasting lipid profile at age 20. And then my daughter's one is turning 20 tomorrow, and they both have had fasting lipid profiles in their pediatrician's office. So.
And if somebody has high cholesterol at that age, the thing is it hereditary? Is it diet? And how aggressively do you treat it?
Yeah, so I'm not a pediatrician, so I can't speak to that.
Let's say they're 22.
Say they're 22. So it's very rare to start a 22-year-old on, say, a statin, just because that would be a very long time, hopefully, that they would be on that medicine. But you talk about, you want to see if they have familial hyperlipidemia. So if one of their parents has high cholesterol, if they've got a strong family history of heart disease, that's a clue. And you talk about diet, so that would be limiting saturated fat, so that's animal fat, so red meat and dairy products, making sure they're exercising, and the things that they can affect. But it's rare to start people on medicine that young, and it also, you wouldn't screen for heart disease that young, just unless they're having symptoms. I mean, there are some rare stories of people developing significant blockages in the heart arteries at a young age, but that's usually the people who have the familial hyperlipidemia with the really high numbers.
Let's take a call from Fauquier County, Virginia. This is Martha. Martha, thank you for calling. Go ahead.
Hi, I'm 66 years old, and I was recently diagnosed with left ventricle hypertrophy. And I'm wondering how serious that is.
Thanks for the call. Best of luck.
Yes, thank you. Left ventricular hypertrophy is a thickening of the heart muscle that's usually diagnosed. You can see evidence of it on an EKG. That's an electrocardiogram. And if it has increased voltage, you can say that somebody might have LVH or left ventricular hypertrophy. It's most commonly diagnosed on an echocardiogram. That's an ultrasound of the heart. So it depends on the degree of LVH and the reason why. So it's most commonly in our country, it's from high blood pressure. So the key there would be to control the blood pressure to make sure that the hypertrophy or the thickening of the heart muscle doesn't get worse. If it's left ventricular hypertrophy and there's no other reason for that, that's usually a different issue, and that's a form of a cardiomyopathy, and that's a disease of the heart muscle. That's less common.
Email question. Viewer wants to know how important to take a statin if you have type 1 diabetes, and if so, why? I mean, what's the connection there?
So I neglected, and that was the one big thing I've left out. So diabetes is one of the major risk factors. Thank you, listener and viewer.
Brenda.
Yes, thank you, Brenda, for saying that. So diabetes, along with high blood pressure, high cholesterol, smoking, and a family history, is a major cardiac risk factor. And when somebody has diabetes, we treat them as if they have coronary artery disease. So the guidelines when you have diabetes are that we treat your cholesterol as if we've already diagnosed you with coronary artery disease. And therefore, all diabetics are recommended to be on statin drugs unless they've got a good reason why not. So it's to prevent a heart attack or a stroke.
In doing a little reading before talking with you, I came upon a statement that women are more likely to die after a heart attack. Why would that be?
Women tend to be older than men when they're diagnosed with a heart attack, and then they a lot of times have more comorbid conditions, so they're sick for other reasons, and they are less likely to recover well after the heart attack. They have smaller arteries, so they can sometimes have mechanical complications after a heart catheterization. Sometimes it's they waited too long to come in, and so the heart attack is bigger and is spread, and more heart is damaged, and so you can have complications from that that lead to an early death.
Let's spend a little time on the irregular heartbeats that we touched on earlier.
Mm-hmm.
Is that something that increases with age as well, and therefore women tend to live a bit longer and would have more of it?
Yes, I think that's one theory, definitely. So the irregular heartbeat, so that irregular heartbeats are arrhythmia. That's a very large category, but the major one that happens with age is atrial fibrillation. And so yes, that does go up with age, and older women are more likely to have it.
And we discussed that it is sometimes it can be asymptomatic, but sometimes you know it. What does it feel like?
So palpitations is the main symptom of that. So palpitations are an awareness of your heartbeat. And that can be fast, it can be irregular, it can be both. So not all palpitations are an arrhythmia, but many times arrhythmias present with palpitations.
I just remembered I was listening to sports radio today. I don't know why, because the Super Bowl's over, the Ravens season's over, but I was listening to it nonetheless, and there was an ad with Dr. J, great basketball player. I think it was Dr. J, talking about his AFib. And the risk of a stroke in that situation.
Yes, definitely. So AFib, the complications of atrial fibrillation, which is an irregular heart rhythm from the top part of the heart, can be heart failure from your heart going too fast and your heart not compensating well in that setting, or a stroke. Those are the two major complications that we see with atrial fibrillation. So the reason that there's a risk of stroke is that the top chamber on the left side of the heart doesn't contract normally, and so blood can pool in certain parts of the left atrium and then form blood clots. And then if they're sent up to the brain, it can cause a stroke. So that's why people are on blood thinners.
Very good. Dr. Shannon Winakur of the University of Maryland St. Joseph Medical Center. Dr. Winakur, we appreciate your time. Thank you.
Thank you.